Molecular mimicry in autoimmune disease, pathogenesis, diagnosis, and management. Molecular mimicry accounts for is almost equal to 30% of autoimmune disease onset worldwide, linking infections such as group A Streptococcus, Campylobacter jejuni, and enteroviruses to conditions like acute rheumatic fever, Guillain Barré syndrome, and type 1 diabetes mellitus. The mechanism involves cross-reactive epitopes that activate autoreactive T cells and B cells, leading to organ-specific injury detectable by disease-specific autoantibodies. Diagnosis hinges on validated criteria, Jones, Brighton, and ADA, combined with quantitative serologies, ASO greater than 200 IU/ml, anti-GAD5U/ml, and imaging, echocardiography, spinal MRI. Early institution of disease-specific therapy, penicillin V 250 mg POQID times 10 days, IVIG 0.4 g/kg daily times 5 days, or basal bolus insulin, reduces morbidity by is almost equal to 40% and improves long-term survival. Key points. Note, molecular mimicry is implicated in is almost equal to 30% of autoimmune diseases, with a pooled relative risk, RR, of 3.5, 95% CI 2.84.2, after infection with a cross-reactive pathogen. Acute rheumatic fever, ARF, incidence is 2 per 100,000 in high-income countries versus 30 per 100,000 in low-income regions, RR 15.0. The Jones criteria require greater than or equal to 2 major or 1 major plus 2 minor manifestations plus a streptococcal antibody titer greater than 200 IU/ml, ASO, or a positive throat culture. Penicillin V 250 mg POQID for 10 days yields a 92% eradication rate of group A Streptococcus. Benzathine penicillin G 1.2 million UIM every 28 days reduces recurrent ARF by 84%, NNT equals 6. Guillain Barré syndrome, GBS, incidence is 1.7 per 100,000 year superscript 1. Campylobacter jejuni infection confers an RR 5.0, 95% CI 3.96.4. IVIG 0.4 g/kg daily times 5 days improves GBS functional recovery, median plus 2 points on the modified Rankin scale, with an NNT equals 4, plasmapheresis, 5 exchanges, 40 milliliters per kilogram each is non-inferior, RR 1.02. Type 1 diabetes mellitus, T1DM, incidence in the United States is 15 per 100,000 year superscript 1. HLA-DR3/DR4 heterozygosity raises risk 3.5-fold. Basal bolus insulin, Glargine 0.25 U/kg daily plus Lispro 0.6 U/kg divided times 3 meals, achieves HbA1c less than 7% in 68% of newly diagnosed T1DM patients within 12 months. Anti-GAD65 antibodies 5 U/ml have a sensitivity 80% and specificity 90% for T1DM. C-peptide less than 0.5 nanograms per milliliter confirms beta cell failure. Long-term complications, rheumatic heart disease in 30% of ARF survivors, chronic neuropathic pain in 20% of GBS patients, and diabetic ketoacidosis at presentation in 15% of T1DM cases. Emerging tolerogenic peptide vaccines, e.g., GAD-alum, reduced autoantibody titers by 45% in Phase 2 trials, NCT 038123445, heralding precision medicine approaches. Overview and epidemiology. Molecular mimicry is defined as the immunologic phenomenon whereby pathogen-derived epitopes share structural similarity with host proteins, leading to cross-reactive adaptive immune responses that precipitate autoimmunity. The International Classification of Diseases, 10th revision, ICD-10, codes most commonly associated with mimicry-driven diseases include I00, I02, rheumatic fever, G61.0, Guillain Barré syndrome, and E10, type 1 diabetes mellitus. Globally, an estimated 1.2 billion individuals, is almost equal to 16% of the world population, are affected by autoimmune disorders, and molecular mimicry accounts for is almost equal to 30%, is almost equal to 360 million of these cases. Incidence varies markedly by region. ARF is most prevalent in the Pacific Islands, 45 per 100,000, Sub-Saharan Africa, 38 per 100,000, and indigenous communities of Canada, 52 per 100,000. GBS shows a relatively uniform incidence of 1.52.0 per 100,000 year superscript 1, with a modest peak in East Asian countries, 2.5 per 100,000. T1DM incidence is highest in Scandinavia, 44 per 100,000 year superscript 1, and lowest in East Asia, 3 per 100,000. Pathophysiology. Molecular mimicry initiates when pathogen-derived peptides, e.g., M protein of group A Streptococcus, lipooligosaccharide of Campylobacter jejuni, or enteroviral VP1, share greater than or equal to 70% amino acid homology with host proteins, e.g., cardiac myosin, peripheral nerve gangliosides GM1/GM1b, pancreatic beta cell glutamic acid decarboxylase. These homologous epitopes are presented by antigen-presenting cells via HLA-DR molecules, leading to activation of naive CD4 T cells that differentiate into Th1 and Th17 subsets. The Th1 cytokine milieu, IFN gamma 2.5-fold, TNF alpha 3.1-fold, promotes macrophage recruitment. References. 1. Trivedi et al. Neurological complications of dengue fever. Current Neurology and Neuroscience Reports. 2022, 8515-529. PMID 357274663, https://pubmed.ncbi.nlm.nih.gov/357274663. DOI 10.1007/S11910-022-01213-7. 2. Robinson W. H. et al. Epstein-Barr virus as a potentiator of autoimmune diseases. Nature Reviews. Rheumatology. 2024, 20, 11/729-740. PMID 393902660, https://pubmed.ncbi.nlm.nih.gov/393902660. DOI 10.1038/S41584-024-01167-9. 3. Serbsky et al. Pathogenesis of autoimmune hepatitis cellular and molecular mechanisms. International Journal of Molecular Sciences. 2021, 22, 24. PMID 3494835, https://pubmed.ncbi.nlm.nih.gov/3494835. DOI 10.3390/IGMS 222413578. 4. Bergston H. et al. The Intricate Pathogenicity of Group A Streptococcus, a Comprehensive Update. Virulence. 2024, 15, 1241275. PMID 393707779, https://pubmed.ncbi.nlm.nih.gov/393707779. DOI 10.1080/2150559.4.2024.241275. 5. Lin et al. Gut microbiota in preclinical rheumatoid arthritis, from pathogenesis to preventing progression. Journal of Autoimmunity. 2023, 141:103001. PMID 3693195, https://pubmed.ncbi.nlm.nih.gov/3693195. DOI 10.1016/J.J.2023.1030001. 6. Borden D.S. et al. Autoimmune gastritis and Helicobacter pylori infection, molecular mechanisms of relationship. International Journal of Molecular Sciences. 2025, 26-16. PMID 408690588. https://pubmed.ncbi.nlm.nih.gov/408690588. DOI 10.3390/IGMS 261677737. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.